Hi, good afternoon. My name is Dr. Perla Marla. I'm one of the heart failure cardiologists here at Mount Sinai and director of heart failure at Mount Sinai, Queens. And I have the distinct pleasure of introducing one of my very dear friends and close colleagues, Dr. Danielle Belardo, who's going to be talking to us about cardiovascular disease prevention and the role of plant-based diets today. And we're really excited to have her. So just a brief introduction, Dr. Belardo is a cardiologist who's practicing in preventative cardiology and lipidology in Newport, California. And she is the current chair of the Nutrition Committee of the American Society of Preventative Cardiology and serves as a member of the Nutrition Committee for the American College of Cardiology. She has a clinical research and research interest in nutrition and cardiovascular disease prevention and has spoken both nationally and internationally on the topic. And so we're very excited to have her. And thank you again, Dr. Belardo, and we're really excited to hear your talk.
Hi, Dr. Perlamara. Thank you so much for inviting me, and thank you to everyone at Mount Sinai and AHA for inviting me to do this very fun talk that I love to do. So I'm just going to get ready to share my presentation. Here we go. Okay, well, thank you so much, everyone, for having me. I am Danielle Belardo, and as Dr. Perlamara mentioned, I'm a preventive cardiologist who focuses a lot on nutrition and cardiovascular disease. So just starting with some of the basics of the epidemiology of heart disease, about 790,000 people in the US have heart attacks each year, and of those, about 114,000 will die. And this is a lot, and the number's actually on the rise. Approximately every 40 seconds, an American will have a heart attack. And the estimated annual incidence of heart attack in the US is over 500,000 new heart attacks per year and 210,000 recurrent attacks. And so cardiovascular disease continues to be the leading cause of global death and accounting for more than 17.3 million deaths per year in 2013. And this is a number that's expected to grow by more than 23.6 million by 2030. And unfortunately, in the US, someone has a stroke about every 40 seconds. And we, of course, consider stroke as part of our overall vascular health and disease and is a huge risk factor for everything that's the same risk factor for cardiovascular disease. When we look at the heart, it's also a risk for stroke as well. So I always like to emphasize that. And unfortunately, stroke kills about someone in the US about every 4 minutes. And we're continuing to see this rise, and stroke accounts for 1 of every 20 deaths in the United States. And how common is heart disease in women is a question I get, because we see a lot of focus and emphasis on breast cancer and on various other diseases, and we're not always hearing in the news about heart health in women. And heart disease is the leading cause of death for women in the US, killing about almost 300,000 women in 2017. And this was about 1 in every 5 female deaths, although I saw that AHA this year, just for the Go Red campaign, updated that number to 1 in every 3 female deaths. So it's continuing to rise. And among American Indian and Alaska Native women, heart disease and cancer cause roughly the same number of deaths each year. And heart disease is the leading cause of death for African American and white women in the United States. And for Hispanic and Asian or Pacific Islander women, heart disease is the second only to cancer as the leading cause of death. So heart disease in women is incredibly important, as it's the leading cause of death for many women in the United States, and we need to continue to focus on mitigating our risk for heart disease. And when we look at causes of death and what Americans die from and what they search on Google and what the media reports on, this chart of data from Our World in Data is pre-COVID. Obviously, this would look a little different now in 2021, but before COVID, you can see all the way on the left for cause of deaths that heart disease continues to be the #1 cause of death in the US. And then when you look a column over with Google searches, you'll see that heart disease is very infrequently Google search, only 2% of Google searches, whereas a huge bulk of that's Google search is cancer. And of course, cancer is incredibly important, but I think it just emphasizes the huge drastic difference in the attention that cancer gets versus heart disease. And then similar when we look at media coverage, we have lots of coverage on things like cancer, obviously now COVID, but even homicide, they have lots of coverage, and terrorism, and heart disease remains to be very minimally covered in the media. So what are the risk factors for heart disease? So when we're talking about heart disease risk, what can we do to lower our risk for heart disease? Well, high blood pressure and high LDL, this is our low density lipoprotein cholesterol, and smoking, these are key risk factors for heart disease. And about half people in the United States have at least one of these 3 risk factors. Then there's several other medical conditions and lifestyle choices that also people at higher risk for heart disease. This includes diabetes, overweight or obesity, dietary choices, physical inactivity, and drinking too much alcohol. So how do we prevent heart disease? Well, I always tell everyone it's never too late to start working on heart disease prevention, because even if it's not primary prevention, which is the prevention of the first heart attack, it's secondary prevention. So prevention of a second heart attack. You can be any age, you could have any disease history, and we can always focus on improving your risk for having further cardiovascular events. And so this is through a combination of nutrition, exercise, stress reduction, and of course, working on psychosocial relationships. And when we look at atherosclerosis, so that's the formation of plaque in the arteries that causes things like heart attack and stroke, it actually develops slowly over many decades. And it's often asymptomatic and silent until it appears as a heart attack. And so the P-Day study was interesting because it was a study that looked at 3,000 subjects who died between the ages of 15 and 34. And they found that atherosclerosis, so this building up of the plaque in arteries, actually begins young in childhood, and young adults often have significant lesions. So even at a young age, the risk of atherosclerosis is associated with these risk factors like high cholesterol, tobacco, obesity, abdominal fat, diabetes, and high blood pressure. When we look at the InterHeart study, this was a large case cohort study that evaluated people over a long period of time. And they found that over 90% of the risk in men and 94% of the risk in women could be attributed to 9 risk factors. These were smoking, as I mentioned again, the risk of a raised ApoB to ApoA1, and what that means is high LDL cholesterol, the bad cholesterol again, hypertension, diabetes, obesity, especially abdominal obesity, and adverse psychosocial risk factors. So dyslipidemia, high cholesterol, this was responsible for more than 50% of the population attributable vascular risk. And so 3 factors they found that were associated with decreased risk were daily consumption of fruits and vegetables, regular but modest alcohol intake, and regular physical activity. And when we look at the Nurses' Health Study, this is a study that followed 84,000 women for 14 years to identify the majority of factors that can reduce heart disease risk. And they identified 5 factors that lowered CVD risk by 80%. And this was maintaining a normal weight, as mentioned, not smoking, regular physical activity, drinking at least half an alcoholic drink per day. But of course, we have so much research to show us that drinking a lot of alcohol is also not good for us. So it's really just some of the association data has shown us that half an alcohol drink per day is okay. And diets high in cereal fiber, marine omega-3 fats, folic acid, high ratio of polyunsaturated fat to saturated fat, and a diet low in trans fat and glycemic load. So what's the key to these reducing risk for cardiovascular disease? What are the key components of reducing risk for cardiovascular disease that all of us can do? And this is focused on these major components that increase your risk for a heart attack or stroke, such as high cholesterol, diabetes, high blood pressure, smoking cessation, obesity, and exercise. And of the ones listed here that we have so much data for to help us prevent cardiovascular disease, the ones that we can actually impact through nutrition for some patients are diabetes, hyperlipidemia, hypertension, and obesity. So what is a whole food plant-based diet? Well, starting with a whole food plant-based diet, it's a diet that focuses on fruits, vegetables, legumes. So this is beans, lentils, peas, tofu, tempeh, whole grains, yams, nuts, seeds. It can include plant oils that are higher in unsaturated fat like olive oil, or minimally or smartly processed plant-based foods. And why is this important? Well, it's extremely important to remember that just not eating animal products in and of itself doesn't make a diet healthy, meaning that even foods like French fries and Oreos, for example, are vegan. So I try to always emphasize that a whole food plant-based diet is a healthful plant-based diet focusing on more of the fruits and vegetables and those whole foods. This study, this was a pooled multivariable analysis that was published in the Journal of American College of Cardiology, and they evaluated over 200 individuals from the Nurses' Health Study and the Nurses' Health Study 2, and the Health Professional Follow-Up Study. And what they found was in 4.8 million person years of follow-up, which is a lot in prospective cohort studies, they found that these individuals, the closer they adhered to a healthful plant-based diet, so a plant-based diet that focused more on eating fruits, vegetables, legumes, whole grains, plant oils like olive oil, things like that, the less likely they were to develop coronary heart disease. And the more closely they followed a plant-based diet eating unhealthful plant foods, so that's like baked goods, so hyper-processed foods like cookies, cakes, refined grains, as well as sugars and sugar carbonated beverages, fried foods, the more likely they were to have cardiovascular disease and develop coronary heart disease. And interestingly enough, if you actually look at the table, you can see that those who followed an unhealthful plant-based diet have the same hazard ratio, similar hazard ratio to developing heart disease as those who eat a very animal protein heavy diet. And the lowest hazard ratio for developing cardiovascular disease is the group eating that healthful, more plant predominant diet. So how do plant-based diets specifically improve these cardiac risk factors? And I think this is an important question. So first, there's consistent evidence that obesity and elevated adiposity can over time increase the risk of high cholesterol, coronary artery disease, stroke, and type 2 diabetes. So this is important to manage in heart disease prevention. In general, actually, when the majority of diets, when formally studied, provide some weight loss, so whether that's Atkins, Zone, or Weight Watchers, or low-fat vegan diets, they generally, if you're in a calorie deficit, weight loss will occur, and that's what they do share in common. Interestingly enough, when they evaluated adherence to different dietary patterns in this JAMA study, what they found was that in 12 months, the lowest adherence was actually the Ornish diet, which is a low-fat plant-based diet, and the Atkins diet at about only 40% who continued on that diet plan, whereas the Zone and Weight Watchers were reportedly upwards of 80%. And when it comes to weight loss and managing obesity, the most important variable is finding a dietary pattern and dietary changes that are most sustainable for you and things that you can definitely stick with for the long term. And when we're looking at improving risk factors for heart disease, we're looking for a 5 to 10% weight loss. And so it should be noted that, obesity and weight loss in general is quite complex, and finding something that works for you is most important. In this interesting study by Turner McGreevy, they took participants, they were enrolled in a 6-month, 5-arm randomized controlled trial, and they went to group weekly meetings where they were randomized to either a vegan group, a vegetarian group, a pesco-vegetarian group, a semi-vegan group, and an omnivore group. And none of the diets emphasized calorie restriction in this study, meaning everyone was encouraged to eat however much they wanted within that dietary paradigm. And the results were interesting. At 2 months, you can see most groups lost weight, but then at 6 months into the trial, you see that some groups regained weight, whereas the vegan group continued some steady weight loss at month 6 and demonstrated the most weight loss of all groups. And this could be multiple reasons. One is that lots of plant-based foods, as I mentioned to you, are very high in fiber as well as water, meaning they're nutrient rich. So lots of plant foods, if you're thinking about leafy green vegetables, carrots, apples, berries, legumes, they're very high in nutrients, but they could be lower in calories. And so that can actually make someone feel fuller longer, especially accompanied with fiber. And so how do plant-based diets improve something like cholesterol? Well, actually, why is cholesterol even relevant? Atherosclerosis, as I mentioned, is caused by adverse risk factors that promote cholesterol deposition in the artery walls. And this is important because the primary drivers of this atherosclerosis can be these elevated LDL particles, as well as when the endothelium, when the lining of the vessels is damaged by things like high blood pressure, hypertension, and inflammation. And so we actually have a lot of data that shows us that eating high amounts of saturated fat, so you find a lot of saturated fat in processed foods, packaged foods like cookies, cakes, desserts, pizza, but also you see a lot of high amount of saturated fat in animal foods, so red meat and cheese and full fat dairy and things like butter. Foods that are higher in saturated fat have been demonstrated in these what we call metabolic ward studies to show higher levels, leads to higher levels of LDL cholesterol, that bad kind of cholesterol. Whole food plant-based diets are relatively low in saturated fat naturally, and various animal products like, as I mentioned, red meat, butter, cheese, which are high in saturated fat, make a huge difference in your cholesterol levels. And there's even this large study where they took calculations of all the metabolic ward studies that I showed you on the previous page, and they looked at the linear relationship just between saturated fat intake and that LDL cholesterol, and they found that there really is, they did a regression analysis, and they found that there's a direct linear relationship. So eating more of those saturated fat products does lead to a higher LDL cholesterol. Well, you may say, well, what about lean meat? Well, lean meat is certainly better for us than eating red meats or very fatty meats because it can have a lower saturated fat content. But even lean meat is interesting because there was this randomized crossover study where they took generally healthy men and women and they were assigned to 1 or 2 parallel arms, either high or low saturated fat. And within each, they were allocated to either a red meat group, white meat, or a non-meat, which was a plant protein group. And they were instructed to consume that diet for 4 weeks in a random order. And the primary outcomes that they looked to evaluate were the LDL cholesterol, ApoB, and the particles, the small and medium particle sizes. So what did they find? Well, the LDL cholesterol and the ApoB, these were higher with red and white meat consumption than with the non-meat. And this was independent of the saturated fat content. And so the best for LDL cholesterol, that bad cholesterol, the ApoB, was the plant-based and non-meat low saturated fat arm. And so we have so much data over time that's showed us this increase of LDL cholesterol really does increase risk for cardiovascular disease. So it really is important to know which foods we can eat that can help lower that more dangerous cholesterol. So, well, what about high blood pressure, hypertension? How does a plant-based diet improve this risk factor? Well, interestingly enough, the Adventist Health Study, so this was a study of 70,000 Seventh-day Adventists, men and women, and they were recruited and diet was assessed based on food frequency questionnaires, and they were categorized into 5 dietary patterns, either non-vegetarian, semi-vegetarian, pesco-vegetarian, lacto-ovo-vegetarian, or vegan, which is just fully plant-based. And they found that vegans had the lowest BMI, but they also had the lowest hypertension and diabetes. And additionally, the vegetarians were found to be associated with a lower all-cause mortality and some reductions in cause-specific mortality, although this happened to be more robust in that study in males. But overall, they found that the vegans had the lowest rates of diabetes and high blood pressure. And, you know, people may ask, well, is a plant-based diet or a very plant-predominant diet or a vegan diet, is this sustainable long-term? Well, it's very much so been sustained in multiple populations like the Seventh-day Adventists. The Adventist Health Study had this fascinating data from their longitudinal analysis of their cohort, where they found that the reference cohort who enrolled in the Adventist Health Study in their 60s, and it showed the proportions of different dietary categories at all ages. Vegetarian Adventist men lived to an average of 83.3 years, and vegetarian Adventist women lived to an average of 85.7 years. And this is 9.5 and 6.1 years longer than the average Californian. So it's possible to sustain a plant-based diet for a long time, and we've only seen in this cohort data that it leads to living a longer life. Other ways eating more plants leads to reducing your risk for high blood pressure is because it may help through multiple different mechanisms. One is something called the renin-angiotensin system, and it can help with sympathetic nervous system. Greater potassium intake and decreased sodium absorption. It can improve blood vessel dilation and some changes in baroreceptors. The DASH diet, which is an amazing diet, it's not a vegan diet, but it's a very plant-predominant diet that focuses on fruits, vegetables, whole grains, legumes, and lean proteins. This trial found that in trial participants with a blood pressure greater than 150 millimeters of mercury, they had an 11.4 millimeter of mercury reduction in their blood pressure by going on this diet. And in the DASH low sodium study, it was even more. It was 20 millimeters of mercury reduction in blood pressure for being on this low sodium DASH diet, which is truly very impressive. Well, what about diabetes and plant-based diets? We actually have lots of data that shows us that the more plants we eat, whether it's from the data we have, whether it's from a prospective cohort study or from just longitudinal epidemiological studies, we find that the more plants someone eats, the more of a plant-predominant dietary pattern someone follows, the less likely they are to have diabetes or develop diabetes. And I think that's manyfold. One is that we find that eating a more plant-predominant diet helps to control weight, which is a huge factor in type 2 diabetes. And it also helps to reduce, if you're eating a lot of whole plant foods, helps to reduce the amount of those processed foods that we were talking about, then can make obesity more challenging, such as those hyper-palatable processed foods like cookies, cakes, pizzas, burgers, things like that, that taste so great, but that end up being more troublesome with regards to cardiovascular risk and risk for diabetes. And we even have a study on what's called secondary prevention of heart disease. So when we talk about prevention of heart disease and we're talking about primary prevention, that's preventing someone from ever having a heart attack. But then when we talk about secondary prevention, we're talking about how can we prevent a heart attack in someone that's already had one. We have a great randomized control trial that was done to assess this. So in the Lyon Diet Heart Study, it was a 46-month study where they randomized people to either a more Mediterranean style diet that was higher in fruits, vegetables, legumes, whole grains, nuts, and seeds, and lower in butter, saturated fat, red meat, and things like that, or they were on their standard diet. And they wanted to see, well, how does this affect individuals who have already had a heart attack? And what they found was that after 46 months of follow-up, there was a impressive 50 to 70% lower risk of recurrent heart disease and of heart attack in the group eating the more plant-predominant Mediterranean-style diet. And as you can see from this chart, what were the things they changed in the dietary pattern? They increased the amount of bread, whole grains. They doubled the amount of legumes, so beans. They increased the amount of vegetables. They increased the amount of fruits. They decreased the amount of meat. The amount of poultry stayed about the same. They decreased the amount of cheese. They significantly decreased the amount of butter and cream. They replaced that with margarine and polyunsaturated fat. And their fish remained the same, slightly higher. And so all of these changes of eating more plants, not going fully plant-based, but just eating more plants and reducing animal products, things like red meat, things like cheese, butter, and cream, all of these different variables, just making those slight changes had such a incredibly powerful difference of lowering cardiovascular disease risk in people who've already had a heart attack. And additionally, we look at the EPIC Oxford cohort study, which is a study that found that vegetarians and vegans had significantly lower all-cause mortality than regular meat eaters. And the Adventist Health study also showed us something similar. And so what can we focus on with cardiovascular disease prevention and diet? Well, I always say perfect is the enemy of good. And so we want to do things that we know are going to help us just do better. And those are small changes which can add up and make big differences. So one, we know we want to focus on a total diet that emphasizes fruits, vegetables, legumes, whole grains, nuts, and fish as one of the main proteins if you are not fully plant-based. Fats, you want to try to replace saturated fat with things like mono and polyunsaturated fat and avoid trans fats. So things, as I mentioned, high in saturated fat, those processed foods, so cookies, cakes, pastries, pizzas, red meat, cheese, butter, these are high in saturated fat, replacing those with a mono and polyunsaturated fat. So if you are a pescatarian, that would be replacing, or even if you're an omnivore, that would be replacing it with something like fish. But as someone who advocates for a lot of plant predominant eating, you can replace it with things unsaturated fat like avocado, tofu, tempeh, chia, flax, and eating more of those plant-based fats too, which can help because they also have dietary fiber. The other thing we can do is reduce our dietary cholesterol intake. So cholesterol only exists in foods from animals. Cholesterol does not exist in foods from plants. So just keep that in mind. The more whole plant foods you're eating, there's no dietary cholesterol in those foods. And although dietary cholesterol has a more, as I mentioned, insignificant, smaller risk of worsening cholesterol, as you can see from the other study I showed you, it's not a totally insignificant risk. It's not completely inconsequential. So that's why our American College of Cardiology guidelines still do recommend reducing dietary cholesterol reduction. The other thing is sodium reduction, so reducing the amount of salt intake. And this actually happens naturally if you're eating more whole foods. More whole plant-based foods and less processed foods can really naturally reduce your sodium intake. And we also want to minimize refined carbohydrates and reduce sugar-sweetened beverages. I always say there's no reason to drink our calories. Things like sodas, diet sodas to me are completely fine, but sodas that have calories in them, those are an easy thing to cut out, replace with water or replace with a diet soda that can help to improve your risk for cardiovascular disease. In general, the most ideal thing to drink would be water. And protein, so trying to eliminate processed meat intake. And all of these recommendations I just made were in our 2019 American Heart Association, American College of Cardiology guidelines and recommendations for primary prevention of heart disease. So how do if you're wondering and you're watching this, well, how do I go plant-based? And I always recommend trying a registered dietitian if possible. You don't have to go 100% plant-based. Just making small, manageable changes can make a huge impact in your health. And to do this, I do recommend trying to find a registered dietitian. Eatright.org is a place where you can find a local RD. This is the American Academy of Nutrition and Dietetics. And now, because of the last year with the pandemic, we've seen a really robust growth of telehealth, and Nutrimity actually has teledietetics. One thing that you could actually ask yourself as well is just do a brief 24-hour food recall with yourself and say, well, how many sugary drinks am I having per day, like soda? How often do I eat out at restaurants or fast food per week? And how often am I getting takeout? How many chocolates, donuts, or fried food, either high in sugar, high in fat, high in both, am I having per day? And how many alcoholic drinks per day per week? You know, those are all things you can actually just tune into for yourself and see, well, which of those can I reduce to make a difference? Some easy actionable tips would be snacking. There really is no necessary need for snacking if you're trying to lose weight. If you are not trying to lose weight, you're trying to keep your weight up, snacking is fine, but I generally think cutting out snacking is a low-hanging fruit for us who are looking to improve our diets. Liquid calories, these can easily equate to one meal equivalent. So always remember, if I'm not drinking water, which would be most ideal, or sparkling water, then after that would be something that's a diet soda or a flavored beverage, but not a drink with calories. And alcohol, for some people, this can be as high as 1/5 of their calories. And it really can go unchecked and be a source of extra calories. And we know it's not helpful from a cardiovascular standpoint either to be drinking too much alcohol. So these are easy places that you can make some quick changes that you could see quite an impressive difference. And fiber, one of the most important things I recommend is, you know, oftentimes people are worried about protein intake or carbohydrate intake or all these sorts of things. And I think there's not enough of an emphasis on fiber intake, and that's getting fiber from real foods. So try to increase your fiber intake. This can help with satiety, so that feeling of feeling full. It can help with weight loss by making you feel more full. And it can help to decrease LDL cholesterol, that cholesterol we were talking about that is more concerning for cardiovascular disease. And as well as there's more research emerging that fiber can actually help with diabetes, and especially with controlling blood sugar. And so different foods that are very high in fiber are things like peas, lentil, beans, of course, all of your leafy greens, broccoli, turnip, Brussels sprouts, different berries such as raspberries, apple, pears. You want to just focus on make a fiber target for yourself. Usually, we want people to get at least 35 grams of fiber per day. I have patients of mine that get upwards of 80 to 90 grams of fiber per day. There is no highest amount you can go, and fiber is incredibly beneficial. So the important thing too, though, just to keep note is while you add fiber into your diet, try to do it slowly. Otherwise, you may get some upset stomach. And recognizing some of the barriers to diet modification are important. There's, of course, cultural reasons in why it could be difficult to make dietary changes, financial barriers, family barriers, and time constraints. And so don't ever feel like you need to change your diet overnight. Don't ever feel like you need to eat more plants. You have to buy expensive plant-based foods at Whole Foods or anything like that. Just keep it simple, meaning make small changes that are sustainable for you. If you could go a meatless Monday once a week, or meatless Monday and Wednesday, and just substitute out the meat you were going to eat for something inexpensive like lentils or black beans, and switching out your white rice for brown rice, and switching out one of the biggest tips that people are always surprised to hear is when I tell them eating frozen vegetables is just as helpful as eating fresh vegetables. If you buy frozen vegetables that are not in any sauces or anything like that, but just frozen fruits and vegetables, the nutrient value is preserved, and it's just as helpful as eating fresh raspberries or fresh broccoli. That's a way to save money too. So just making small changes that are sustainable for you, that can last over time without feeling like you need to break the bank or go 100% all in. Just know that the small changes do add up. Thank you so much for having me. I really appreciate being a part of this series with AHA and Mount Sinai. And thank you so much again.